A high-performing hospital system, as well as the diligence of New Yorkers, are the keys to stop the spread. Second, the vaccine will end the COVID crisis. We must vaccinate 70 to 90% of our 20 million New Yorkers, and we must do it quickly, safely, and fairly. We must also learn the glaring and costly lessons of America's failed public health system, so we are better prepared for the next time. And as we all now should realize, there will be a next time. Third, we must deal with a short-term economic crisis, a record $15 billion state deficit that must be addressed in the next several weeks. Fourth, we must plan our economic resurgence. We simply cannot stay closed until the vaccine hits critical mass. The cost is too high. We will have nothing left to open. We must reopen the economy, but we must do it smartly and safely. Also, we must energize our lagging private sector and rebuild our economic platform, our transportation system, our infrastructure system for the next generation of growth. Fifth, we must seize the opportunity to make New York the global leader in the long overdue economic shift to green energy. That is the smart thing to do. That is the right thing to do. And it will create thousands of good, secure jobs. Sixth, we must be the first to anticipate how COVID will transform our society and economy. And we must capitalize on those coming changes. Seventh, we must address the systemic injustices exposed during this year's low tide in America, the inequity, the racism, and the social abuse. And my friends, if that wasn't ambitious enough, all of these plans must move forward simultaneously. It will be hard. It will be the greatest test for government since we mobilized to fight World War II. It will be the greatest opportunity for advancement since post-World War II. Today, I will address the first steps we must take. Most immediate. Until the vaccine reaches critical mass, we must regulate and implore New Yorkers to be diligent. COVID fatigue is not an option until COVID itself is fatigued. We must defeat the enemy. If we tire before the enemy tires, we lose the war. It's that simple. We must slow the spread to keep our COVID numbers down. In the interim, we must manage hospitalization so the system is not overwhelmed. We need the highest level of performance from our hospitals and local governments. If the caseload threatens to overwhelm the hospital system, we will need to close that region again. That is the worst-case option. But even more broadly, we must realize that it is time for an entirely new way of thinking of our public health system. Our nation's public health system was just not prepared for this. Despite the experience of SARS 17 years ago, MERS and Ebola 6 years ago, several dengue outbreaks in the last few years, this country couldn't even produce something as simple as enough nasal swabs. Our laboratories were unprepared, and our hospital systems had no ability to manage the surge. The federal government did not even screen visitors at the nation's gateways here in New York, and it still doesn't. Our nurses and doctors were heroic, but our country couldn't provide them with enough masks and gowns. It was like sending soldiers into battle without bullets. We have had 100 years of medical breakthroughs since the last pandemic in 1918, yet we were decimated by this virus.